Thanks, ClearNet. It's good evening, everyone. It's my privilege and pleasure to initiate today's NIGF Diamond Oration on Safe Motherhood Initiative, a silent revolution. This day is particularly very important because today is Safe Motherhood Day. We have taken a great journey of academics with NIGF under the guidance of our patron, Dr. Sharda Jain Madam, and the leadership of none other than our own Dr. Sadhana Gupta Madam. I request our patron Madam, Dr. Sharda Jain, to shower her blessings to all of us. Over to you, Dr. Sharda Jain Madam. Everybody knows Dr. Sharda Jain. Madam has been teacher
Ankna,
of...
please stop slide share. Ankna, please stop slide share so that we can see Mala. Stop slide share. Stop slide.
We all know Dr. Sharda Jain Madam. Madam is a teacher of teachers. She is a patron of NIGF.
Mala, enough.
We are waiting to hear from you, Madam. Over to you, Madam.
Thank you, Dr. Mala. My great regards to my colleague and mentor, Dr. FOGSI, and Dr. Usha Sharma, and my other senior colleagues. It's a great day. Motherhood is definitely very precious. Can we have this off, madam, please? Motherhood is great for every woman. But as far as our country is concerned, whenever a woman wants to become a mother, she puts her life into danger. Knowingly. It's never unknowingly. मैं जिस प्रदेश से आती हूँ यूपी में, उसमें इसको बोलते हैं लेबर प्रोसेस को बोलते हैं जापा, जान जाके पाना. So that's the kind of things are there, and I'm glad that on a national Safe Motherhood Day, which is on the birth of Kasturba Gandhi, great dedication to us. And I think my big salute to all the gynecologists of this particular country, that along with gynecologists and the government of India, they have brought down maternal mortality to a very reasonable and respectable goal. We are still far more than Sri Lanka, our neighbor, and even Bangladesh. And I think, you know, our journey had been a long, but I'm sure about it. We will definitely have a very respectable development goal, which is set on by the body, international body, as 70 per lakh. And I'm sure from 97 today, we will definitely come down to 70. And I appreciate that this particular talk on the safe motherhood is given by Dr. Sadhana. And she has been working very, very hard at the grassroots level. And I think, you know, she speaks her story in a very silent way by this particular oration. So my regards to everyone again. Thank you very much. I would like Dr. FOGSI also to speak a 1 minute note for Dr. Sadhana. Dr. FOGSI?
Can you hear me?
Yes, madam, we can hear you.
Good evening. I echo the voice as far as Dr. Sharda Jain is concerned. Sadhana is a great person, humble, and who is really working hard. And she is going places. I mean, a person who has so many achievements, and you can see that the humbleness on one side. And look at the word she has chosen, safe motherhood, a silent journey, you know, that quietly doing the work. And I think we really wish her all the best, you know, and we wish every mother of our country to be safe, alive, because the mother is the most important person for the whole family. So I would say my heartiest congratulations to Dr. Sadhana, to Dr. Sharda, to Dr. Usha, Mala, Madhu, each and everyone. We all women have gathered here to make our mothers safe. Thank you.
Dr. Usha Sharma ji, 1 minute by you.
Oh, thank you so much, Sharda. I really, you know, I have no words to say for Sadhana Gupta because I know her for the last so many years As a student also, I was her examiner in postgraduate course, and she did really so well. Probably she got the gold medal. And we
Correct.
all know that she's a very hardworking, very competent. She goes to the grassroots level to initiate the things and to promote the things. We all know that we know about the safe motherhood for the last so many years, but still we have not achieved the target. And so till we collaborate with each other and we just join hands together, otherwise it is not possible to promote safe motherhood. The main thing is we have to create awareness to the grassroots level. And that is why today Sadhana is going to talk about the safe motherhood. But I will request all the persons, all the esteemed members who are today joining this program, they should work hard at their level to propagate the things regarding the safe motherhood. Because what I feel, safe motherhood or Surakshit Matrat is the right of every woman. And in ideal circumstances, not even a single maternal death should be there at any point of time. But unfortunately, we have not yet achieved the target, and still we have got about 97 maternal mortality, which we have to bring down to 70. And I'm sure with the deliberation of sadhana today, we will really be very much charged up, and we will work for this. We will all work hard for the interest of women empowerment. And thank you very much. I will not like to take more time. I have already spoken more than 1 minute, as Sharda allowed only 1 minute. I'm so sorry, Sharda, but I was led away because our sadhana is so good, so loving, so affectionate, so competent, hardworking, and knowledgeable that we are all with her. Thank you so much, Sharda.
Over to you, Mala.
Thanks, madam. We have the blessings of our seniors with us, and we will definitely take the message to the grassroots levels. Now I hand over the platform to Dr. Amrita Jaipuria to conduct the scientific program of the evening. Over to you, Dr. Amrita.
Thank you.
All know Dr. Amrita is a very hardworking person, and she's the chairperson of the Gorakhpur OB-GYN Society, and she's the secretary of the ISOPA chapter of Gorakhpur.
Thank you, Dr. Mala. Thank you so much. Thank you for the kind words and introduction. And a very good evening to all the stalwarts, dignitaries, faculty, and attendees. A hearty welcome to all of you, to all the endeavors of NIGF. Today is the birth anniversary of Srimati Kasturba Gandhi, wife, constant companion, and active member of all initiatives by Mahatma Gandhi. The Government of India utilizes the birth anniversary of Kasturba Gandhi to generate awareness and drive the message of safe motherhood amongst the masses. The health of pregnant and new mothers, along with their newborn children, is the reflection of health and condition of the society. The basic pillars are family planning, antenatal care, obstetric and newborn care, postnatal care, post-abortion care, STD, HIV, and AIDS control. The North India Gynae Forum, in a very small duration, under the most dynamic leadership of the patron Dr. Shada Jain, and the mentorship of Dr. Usha Sharma, Dr. Kamal Bakshi, Dr. Chandravati, Dr. Meera Agnihotri, Dr. Lakhbir Dhaliwal, and Dr. Saroj Mudgil, is working at all the fronts of women health. The office bearers of NIGF, Dr. Sadhana Gupta, Dr. Ragini Agrawal, Dr. Achla Batra, Dr. Amrit Pal Kaur, Dr. Jaya Chaturvedi, Dr. Mala Srivastav, and Dr. Sangeeta Gupta are all working with full force for this cause. So the North India Gynae Forum is taking this drive further, and who else can shoulder the responsibility better than our superstar speaker and the present president of NIGF, Dr. Sadhana Gupta. The topic is Safe Motherhood Initiative, a Silent Revolution. I would be honored to call upon the revered chairpersons for the talk. Dr. Usha Sharma, ma'am. Padma Shri Dr. Usha Sharma is one of the most decorated and dynamic doctor of our country. She has led the Department of Obs and Gynae and also many institutions of Uttar Pradesh, achiever of many awards, authored books and chapters.
Cut short.
Yes, ma'am. Cut short hi kiya hai. Authored books, chapters in books, and innumerable publications to her credit. Dr. Kamal Bakshi, ma'am, is the senior consultant OBGYN. With
Thanks,
50
bus,
years.
bus.
Yes, ma'am. But I would
Bus
like to mention you were the first Indian obstetrician to develop and standardize in utero fetal skin biopsy technique, fetal diagnosis, and in utero blood transfusion. More than 250 publications at your credit and many awards to your credit. Dr. Madhu Nagpal, ex-professor and head GMC Amritsar and SGRD IMS and Research Amritsar, faculty for certification course in GDM and contraception with PHFI, publications in national and international journals, invited faculty to many prestigious conferences, and ex-president of Amritsar OBGYN Society. Dr. Saroj Mudkil is one of the patrons of NIGF, and she is very decorated. She has been the professor and head Israna Medical College, Panipat, and she is the achiever of many awards, Rashtriya Gaurav Award, Glory of India Award, and Best Citizen Award. We have Dr. Leela Vyas with us, head of the Department Obs and Gynae, CKS Hospital, Jaipur, senior consultant, Cocoon Hospital, Jaipur, senior consultant, aesthetic and cosmetic gynecology at Vyas Clinic, Jaipur. Dakshita and Laksh mentor at NHM Rajasthan, former senior and professor and unit head IVF consultant, member of Research Review Board, SMS College, Jaipur. She has held many positions and many responsible posts at Jaipur, UP INSAR, Vice President FOGSI 2018, and Chairperson ISAR Rajasthan. All the chairpersons are welcome. Welcome to this platform, ma'am, and over to chairpersons. I would request Madam Madhu to please introduce Sadhana Gupta, ma'am. Hello, am I audible?
Yes.
Okay. Do we have Dr. Madhu Nagpal with us?
Yes, ma'am is there, Madhu ma'am. We can't hear you, ma'am. Please unmute yourself, ma'am. She's not audible.
So may I request Usha Sharma, madam, once again to talk a few words about Sadhana, ma'am. Say a few words.
Actually, what did you say, Amrita?
Ma'am, madam, I've requested you to just say a few words about Sadhana, ma'am, once again. Just a formal introduction, and then we'll start with the oration, the diamond oration.
Today, as we know, it is a Safe Motherhood Day, and we all are trying hard to save the lives of our pregnant mothers in every way. And I have to say about the sadhana, as I told you before, that sadhana is a person who is a very hard-working person. She is a knowledgeable person. She is very competent. And what she is doing, that she is going from one place to other place to propagate knowledge about the different subjects for the women empowerment and for the promotion of women health. And today she will be speaking on safe motherhood on this day, about the safe motherhood and Surakshit Matrat. And I'm sure that her deliberation will be very, very informative and very fruitful for every one of us. And I'm sure after her deliberation, we all will be quite enthusiastic to propagate these things, because still we create awareness about the safe motherhood. We know that there are many plans and there are many projects of the government which are really very helpful for this, but most of the public does not know about it. And I'm sure Sadhana is the best person to speak about it, and she will cover the topic very well, and the deliberation will be very, very fruitful for every one of us. Sharda, I wish you all the best, and I really appreciate your hard work, your competence, and your knowledge. Thank you very much. I think I should not take much time, and now Sadhana should speak.
Can I speak something?
Yes,
Sadhana ji,
yes,
can I
yes.
speak?
Yes, yes.
Oh,
Safe
Leela,
Motherhood
thank-
Committee, I think. Namaskar, ma'am. Leela बोल.
Namaskar.
Ma'am, Safe Motherhood Committee chairperson भी यही रहे हैं, Sadhana ji. And Sadhana ji's book on the safe motherhood, I think all of my students, they read it. Even my colleagues, they asked me, यार किताब है तो हमें भी दे दो, हम पढ़ेंगे. So Sadhana ji is the master for the safe motherhood, and definitely today on the day of that, शायद साधना जी हम भी आपके नाम से कुछ ऐसा ही डे रखना चाहते हैं कि सेफ मदरहुड प्रोपोगेशन ऑफ दिस फॉक्सी सोसाइटी. चलिए, so welcome Sadhana ji, and we know that this is in your heart and you will speak everything which is needed in our country. Still we need it. Chaliye, welcome.
Dr. Madhu.
Yes.
Yes.
Can you hear me now? Can you hear me now?
Yes.
Yes,
Yes,
ma'am.
Well,
Yes, ma'am. Thank you.
Welcome, Dr. Sadhana. I have very few words to talk about your personality, but I lots of things to talk about Dr. Sharda and Dr. Sadhana's combination. You made the world very small. You bring so many people together. Like I've seen Dr. Saroj Mudgil. I think last I saw her in Dehradun or Rohtak, maybe after many, many years. So that's such a thing you have done, that you brought everyone together on this platform. And for your knowledge, everything everybody knows, your CV everybody knows. So I will just not waste the time and welcome you to hear what your heart and mind says about this. I remember a little feeling when a mother was dying. It was a very torturous feeling in the labor room or OT, and seen on faces of everybody concerned, maybe the paramedical, medical, or everybody. Let's pledge that we do not have more deaths. It was very torturous. Welcome. Talk more on this safe motherhood so that the message is propagated. And we'll definitely, in return of that, converse for your presidentship. Welcome. Welcome.
Thank
Stage
you.
is yours.
Thank you. I'm humbled and honored with the precious blessings from Dr. Sharda Ji and Dr. Usha Sharma, Dr. Madhu Nagpal, we love Dr. Leela Ji and Dr. Saroj Mudgil. On the Safe Motherhood Day, I welcome everybody who is listening with us and who is with us. So let me share my screen. So Safe Motherhood Initiative, a silent revolution. And today, I will carry everyone on the journey that how we have come to this Safe Motherhood Initiative, which is now considered a day-to-day word, has gone through a very tough journey, not less that mountainous journey which Dr. Sarveshwari Nautiyal is undergoing with it. So I have all gratitude for all the precious togetherness, cooperation, blessings, good wishes for every program, every publication, which we have done all together in my journey. So true revolutions are slow and silent. They demand our transformation. It is not noisy. And let us go through what has been the journey for safe motherhood. So maternal mortality, our all esteemed chairperson has talked about that pain, that
heaviness on the consciousness what we had with the maternal mortality. So it is the greatest health inequity of 21st century till now. It is not just a personal tragedy. It is not just a developmental issue or humanitarian issue. It is a human right issue. So nature has designed human reproduction a little difficult, and it is around 285,000 women die as a result of pregnancy related complication. And important thing which everyone said, that our region, Southeast Asia and India, we contribute to a lot of maternal criticality and mortality, and it is the highest inequity between developed world and the developing world. So still we have around 100, we have a lot of regional variation. Still we are not like a green, it is a quite a lilac color which our country have. So where we are, when we are the third largest economy of the world, we are still contributing to 17% of global maternal death. What is estimated, it is around 97 or 103 per 100,000 live birth, but actually it is often masked the various regional variation and the subgroups of the population. And in our country, significant population lives in the region where the maternal mortality rate is around 130 to 150 per 100,000. So what have been the people's hope, or what have been the ground realities? So today we carry on, we have a flashback of the Safe Motherhood initiative journey, and it is a real thing to think about it, that we took a centuries and a lot of outrage and sense of guilt and shame that we started talking about Safe Motherhood initiative. A great injustice against mother, children and families prevailed throughout the world, not only in developing world, but also the developed world. Still, we have a lot of wide variation, wide gap, and we have the ongoing challenges like COVID pandemic, last 2 years, wars, climate migration, which put out the fresh challenges to us in personal, as a healthcare provider, as a government and the program coordinator. Now, the health of the mother has been acknowledged to be a cornerstone of public health, and it is not long ago. Actually, it was after around passing my post-graduation in around 1985-86 that the Safe Motherhood initiative was taken at international forum in a serious way. It has been for a long period of time. It was a developmental portal, did not invest much seriously in Safe Motherhood, and it has been tended to seen as a subgroup of other programs like a child survival or the reproductive health like contraception services. So what were the feeling in 1980s? That they are too complex, Safe Motherhood initiative. They cannot be getting activated. They cannot be initiated because we are under-resourced or overstretched healthcare system. Despite this, we had the technology, we had something to give the safe childbirth, but the grassroots organization and international health organization took a great time when we started talking to the political people that the Safe Motherhood initiative is so very important. So a little bit about history, because it will interest everyone. Again, auxiliary in WHO played a very, very important role in development of concept of reproductive health. And in 1985, the WHO, with funding from UNFPA, provided support to first community study in maternal mortality in developing countries. It is the year when I passed my post-graduation under the examinership of Dr. Usha Sharma. So it is only in 1985, and WHO first produced the guesstimate, that is estimate with guess, that around 500,000 women are dying during childbirth every year, and 99% of them from developing world. In 1987, World Bank in collaboration with WHO and UNFPA sponsored Safe Motherhood conference. And then there was a launch of Safe Motherhood initiative as a major milestone so that we can reduce the global burden of maternal mortality, particularly in developing countries. And it issued a call that we must reduce maternal mortality by 50%. A key perception of 1987 conference was the relative neglect of women health, and that we were more like concerned about the child survival and health, more point most forcefully made by Ellen Rosenfield and Deborah Mann, that where is M in MCH? So we are more concerned. Every top government leader, they joined the conferences of the which is related to child survival, immunization, but not for the maternal health. So this is a painful question, where is M in MCH? And we have come a long way. Then there was a IAG which included like a government, IPPF, many organizations, WHO, UNICEF, UNFPA, they joined hand, and that lead to series of meetings, regional and national conferences, and the Safe Motherhood initiative existed in the world as a very, very important part of the public health issue. And all events that make pregnancy unsafe, irrespective of gestation or outcome, is the parcel of Safe Motherhood. So MDG goal, then it came that reduce maternal mortality by 75% from 1990 to 2015. And the basis of MDG, it is recognized by country leader, because the political leadership is the very, very important thing. And the saving life, we recognize that investing in mother, investing in women is investing in our economy. So it is not only intrinsically valuable for every family, but it affects the family, community, and country as a whole. This is the FOGSI Logic Initiative and FOGSI SOGC, that is the Society of OB-GYN of Canada. And that was the toolkit made, and the FOGSI was one of the participating agency, which shows that 5 things which still remains the keystone for the Safe Motherhood initiative. Entrance, it is our national health priority. Focus on few targeted initiatives. What Dr. Sharda Jain always say, few things today, make anemia free, make PPH preventable mortality. So few initiatives, strengthen ownership at the grassroots level, continually innovate to maximize available resources. Now, what we have to utilize maximally, and reinforce accountability by consistently measuring that what we have achieved. So pillars of Safe Motherhood, what Amrita has just said, these are the family planning, antenatal care, obstetrical care, emergency care, anti-HIV, and all the pillars are there. And important thing that we have to address inequity and the inaccessibilities of healthcare. So we are in 4th decade. We have crossed the era of MDG, and we are here with the SDG, which is going to have the target on 2030. And what is the thing that we have to reduce the inequity? We have to reach the marginalized and excluded people. And what we say that in a professional body, we must have that on the top position who can represent their workforce, their population, that what are their problems and what is the solution. So we have to provide a maternal health ecosystem by providing quality health care, creating a desire for care. That the people must have the desire to get that good obstetrical care facility, ensuring that it is affordable and it is physically accessible in ground root level. So let us go what happened in our country as a Safe Motherhood initiative, where we worship all the Devis in our country. So past, present, and future, Ayurveda has been a very, very positive about childbirth. It specifies, like since time immemorial, cleanliness, isolation, temperature control, and the availability of skilled birth attendant. They have crossed also modern science, because they think that the fetus is though interdependent on mother, but it is an independent soul, and emphasize on good things and the good thoughts. So what we call today the Garbh Sanskar, and the whole of the world is thinking about it. A very, very important journey what we had before independence. 1885, what we see, Dufferin Hospital. Every city we have Dufferin Hospital. So this was the center of Dufferin Association. It started in 1885. Lady Harding School, which is now Lady Harding Medical College. It was started in 1918 in Delhi, which offered health visitor course. 1925, Lady Chelmsford League formed for the developing maternity and child welfare services. 1931, Indian Red Cross Society established MCH Bureau, and Chennai was the take ahead, and it was the first necessity to set up separate section for MCH in Public Health Department. In 1938, Indian Research Fund Association was established for cause analysis and incidence for maternal morbidity and mortality. And in 1946, Boer Committee recognized high maternal mortality and emphasized measures to reduce it. And it was a golden statement, much ahead than all of the world, that these deaths are preventable by good quality health service. And Boer Committee was the first in the world to give word idea of primary and universal health care. So I want to emphasize that India has been always a very positive, proactive, and a thoughtful nation. What happened after independence? 1952, primary health center were spread up all over the India. The first country in 1953 who launched National Family Planning Program with the free contraceptive. 1970, we have All India Hospital Postpartum Program. Every medical college, every district hospital has one. 72 MTP legalized, 76 MTP liberalized. In 1977, Community Health Worker Scheme launched, and in 1978, India was signatory to Alma-Ata Declaration for Primary Health Care to all by 2000. In 1983, MCH and Family Welfare integrated under National Health Policy, and in 1985, Universal Immunization Program. 1987, Worldwide Safe Motherhood Initiative, 1992 Universal Immunization ORT and the Safe Motherhood Program, that was a CSSM. Then again 1995 Unified RCH Program, 1995 National Maternal Benefit Scheme, 1996 Exemplary Pulse Polio Immunization and PCP and DT Act to cover the imbalance into the sex ratio. In 2000, National Population Policy, and in 2005, Government of India and Ministry of Health and Family Welfare launched National Rural Health Mission, and that was a real game changer. Still, we have with us such a proud, like a journey which we can be proud of our legacy. We have the EAG state, high performing and low performing state, but important thing that all Safe Motherhood initiative are in the background of certain factor. It is not only the health issue, mass literacy program, agricultural land reform, legislative for upliftment of deprived class, and empower and education for women are the integral part. Which state have the good education and empowerment for women, good literacy, good involvement, uplifting of the deprived class? We have the better statistics, what our latest NFHS data says. So we see a lot of disparity. We have like Assam 215, even in Uttar Pradesh it is around 150, and in southern and the western we are crossing up to the double edge. So few things which is very important for Safe Motherhood, that is the why mothers die. That is cause analysis, because life is a plurality and death is a uniformity. So we all know we have direct cause, indirect cause. We know what are the causes: PPH, hemorrhage, infection, unsafe abortion, hypertensive disorder, and it can be the direct cause or the pregnancy related cause, direct, indirected, late, and the coincidental. And we have all these statistics which we are talking about. But important thing is that the maternal mortality is not statistics. It is not numbers. It is not rate, or it is not ratio. It is women who have names, face, and we have to bear that this was the most terrible way of dying, patient convulsing with the toxemia, eclampsia, bleeding to death, or the unbearable pang of obstructed labor or agony of puerperal sepsis. It is because it is heavily on our consciousness, because it could have been prevented. It should not have been allowed to happen. And it is an event that bears and should bear so heavily on our collective consciousness. So this is a statement, and that's why we want to know how many mothers died, why they died, where was the system less, what we could have done, how we can monitor, and how we can have a strong advocacy for Safe Motherhood initiative. So from maternal death review, we came to maternal death surveillance review, because every mother's story speaks. What happened in society, what happened in community, and MDR was replaced by the maternal death surveillance response, because we want to have a what was not the medical cause of the death, but what was the action, what was the surveillance, and what happened at the society at large and healthcare personnel. So MDSR was a very, very important, is a very, very important tool, because when we read each story, it offers an opportunity for all of us. What went wrong in community, what went wrong in home, what went wrong since childhood, and what went wrong in our healthcare facility. So we have the always inspiration. Everybody wants some role models. And we have role models in August audience as a chairperson. Dr. V.P. Pelly, who made a beautiful, take 10-year, always confidential inquiry of maternal death from the Kerala. And no way that the Kerala has achieved the 20 per 100,000 maternal death, close par to the developed world. And they are analyzing without blame and shame that what is happening, and they are giving very, very doable recommendation to clinicians as well as the bureaucrats and the government. So the Western world cause are different. Their solutions are different. Their climate is different and their culture is different. So on the professional body, we have to work together. Our work like this, what the FOGSI has done, that we can do at the national level at many, many fronts. So we have the 3 delays. We all know we have now the ASHA, we have the ambulance. And what I was just in the last 3 months back on the Jorhat, I saw this water ambulance when I was the bank of Brahmanar. I said, what is going on coming from that bank? And that is a water ambulance carrying pregnant patient from the Mudgil to the Jorhat. And this is the thing, that how we can really save the mother if we want to have that desire. And the drone which can lift, do the airlifting from like the Kumaon region, from in Assam region, where we have been blessed to surrounded by Himalayas at 3 sides. They are our armors, they are our soldiers, but they have the different, like their mothers have a difficult accessibility to the healthcare, and the drone and the water ambulance. These are the things which can really matters. So from kindly, Anka, please mute everyone. So we have come a long way in my long journey of 30 years. Why mothers die to saving mothers. And Amrita is with us. We have done 2 international conference on the saving mothers, and our ways are optimizing obstetrical care, deliver quality care. Anushka, Anka, please mute everyone. Optimize obstetrical care, delivery quality care, and respectful maternity care. So what can be the issues? That is the risk approach and the primary health care, operationalizing FRU, that is the first referral unit, attack on social and the cultural factor. That's why our all association, our all OB-GYN are so passionate about reaching to people, because we have to cross the bar. We have to cross the bar on the social and the cultural factor. So what are the primary key intervention which leads to good maternal outcome and a good maternal health? That is early registration of pregnancy, good antenatal checkup, dietary supplement, institutional delivery, EMOC, emergency obstetrical care, postnatal care, family planning, and review and analysis of each maternal death and the criticality. So that is very, very important throughout country. I'm emphasizing on the near miss documentation, so that we know what happened and how we can prevent the criticality. So these are few RCH1, RCH2, and I will come that the operationalization of the first referral unit is so very important. And always we have to look into health of the people. So when Janani Suraksha Yojana and NRHM came, the obstetrician and the doctor community was so skeptical about it. How come it that the ASHA is given rupees for bringing the women for the delivery? But it was the most like revolutionary scheme which has been done anywhere in the world, that is in India. It was cash on institutional delivery, focusing on low performing state and creating the cadre of ASHA. So like bringing up leader right from the community. So that was something exemplary. And now we look at the ASHA right from registration to postnatal care to the growth retarded babies and the vaccination. And they are our important pillar. What were the challenges? Hopes and realities were quite different also. So challenges were administration, quality of care, weak referral system, and shortage of staff when the people started pouring into the institution. But what we achieved, marked rise in institutional delivery, and very, very important thing, which everyone will feel, that community is sensitive to good quality obstetrical care. Everyone says that we need iron folic acid. Everyone says that we have to go to the hospital for the delivery, and it intervened all the challenges of the today's people, that is poverty, inequity, and accessibility. So JSY is something which we can be proud of. And what is the second important strength of this, that it was focused on changing behavior of people. If they choose to come for institutional delivery, then they will have the benefit. So it was a behavior change communication tool as well. So it was a very, very important, powerful program, and it has shown more impact in the low performing state, but even high performing state got the benefit of the Janani Suraksha Yojana scheme. So when the lot of people started coming into the institutional delivery, our ways are that we have to give them the quality obstetrical care, which was demanded by our people also. So supply side and the demand side both have to improvise with the Janani Suraksha Yojana, which was a revolutionary something in the Safe Motherhood initiative in our country, which is so diverse, so complex, and so heterogeneous country. So now the next challenge is the quality obstetrical care, which we owe to our women and to our country people. So these are all advantage what we have achieved, and what you can see, that is still it is a great rural urban divide. And we have to reach to doctors who are practicing in the small cities, make them member of professional body, do educational program for them. Now virtual connectivity is also there. So that great rural urban divide we have to cross, and educational and the empower, like employment opportunity to our women in the rural area. Many programs are there, Poshan Abhiyan, many state-supported programs are there. So political will is there, and our advocacy also has added to it. Now, another important issue is the availability of emergency obstetrical care. So almost like around 11 to 17% of death occur during childbirth, as well as the criticality, and 50 to 70% in 24 hours postpartum. So the period around delivery is the thing where we have to, women must have a good quality emergency obstetrical care. So the operationalization of the first referral unit is important, and we have to have a very effective intrapartum strategy, which include BMOC and the CMOC. It is one of the most important intervention which actually saves the life. So MDG goal, this is the meeting which I attended in 2014, and MDG goal was the task shifting for the basic emergency obstetrical care, for the anesthetists and for the paramedical nurses, so that they can perform all the 5 measures for the BMOC. There were a lot of opposition from doctor community, say that it was like it can be dangerous, we cannot do the task shifting. But believe, people are living in Bhutan, people are living in mountains, there is no doctor is there where the women will get the emergency obstetrical care, and that breaking the barrier in our mindset is very, very important. So BMOC, we have all the 7 things: antibiotic, anticonvulsant, uterotonic, removal of retained product, assisted vaginal delivery, MRP, and resuscitation of newborn. And CMOC include blood transfusion and the cesarean delivery. What is the ground reality? We have a lot of nursing homes in the private sector, but these are the latest paper which says that the EMOC is available mostly only in hand of obstetrician and mostly in urban area. So in rural area, still the accessibility of BMOC and the comprehensive emergency obstetrical care is too low, and we have to look into this, bridging the gaps. Just now, what Madam was saying, that I'm traveling all over, because actually when we travel, we know what is happening in our country. So it is Varda Sevagram, Dr. Poonam Vishwakarma is with us, and they are having the first midwifery-led care unit We have a beautiful, it is serving all rural people or low middle class to the poorest class, and they are having birthing bed, they are having the exercise ball, and our midwifery registration about 20 to 30, that is first batch which is being done, like they are being trained for midwifery and they have the skill lab. So revolutions are being done at the silently. They are not only in big cities, they are not only in the 5-star hotel. Revolutions are there first in our heart and hand and head, and they can be anywhere. So rightly, like reflecting the spirit of Mahatma Gandhi, who said that our India lives in the rural people, and it is so like inspiring to see, and it makes you so proud that we can do together so much. A government is doing a lot of things, iron, folic acid, fortification of food, good like a informed healthcare delivery system, and the food fortification is going to come in way. NIGF is all set for anemia Mukt Bharat and the iron, folic acid, multi micronutrient supplement, and we are going, and the food fortification is going to have. Professional bodies like FOGSI, ISOPAR, NIGF, DGF can do a lot because we have the strength of professional and we are spread all over. So FOGSI, which have been working since 30 years, what we can together achieve? We can impart skill and teaching to peer. Creating educational module, combinedly we can do for paramedical, we can do for non-specialists, we can do for specialist doctor. Supporting hand for clinical auditing. We have to support because our practitioners are sometimes busy or they don't know. Monitoring support through member bodies and adopting adjacent rural area or place for routine as well as emergency. So few, I like Dr. Sushma Bakshi from Baroda. I say they have made WhatsApp group for the one village and they carry like take care. So if there is any emergency on group, they say that you can refer this patient to this hospital where bed is ready and the specialist is ready. So the right use of technology and the association of professional bodies can do wonders. FOGSI has done what EMOC for, that is the comprehensive emergency obstetrical care in medical institution for non-specialist doctor. They have been satellite because Manipal, like Dr. Pratap, I was very young, Dr. Pratap was very young. So his first lecture was not on infertility, his first lectures were how they are making change in the rural area of Manipal and how the Sevagram, like Varda Institute, what they are doing so good. Dr. Sanjay Gupta started eclampsia registry and suddenly we came to know that people were not using Maxer, they were using like cocktail regime or the diazepam, and that led to a lot of programs, and now the around 90 to 95% people are using Maxer very, very confidently. And now the second issue is the quality of the obstetrical care, which we owe. What we need for the quality infrastructure, human resource, good clinical practice, adverse event recording, complication management, good statistics, and above all, the patient satisfaction. So every government can make, every person who has the money can make the building, but the human resource is at the center of the quality healthcare. So humans, it is a human science and human resource is the most important thing. And we have again a missing link in between them. So inadequacy of human resource for the emergency obstetrical care is a big gap in our country. And what are their qualifications? They must be able to detect complication, handle complication and referral. So what are the challenges? It is immigration. Like people are going to Dubai and the Middle East. Abandonment of public structure. In COVID time, there was a lot of issue, lot of like a constraint on them. And likewise in rural area, safety, housing, educational issues in rural area. So whenever there is a staff shortage, it will weaken every aspect. No single obstetrician can do. We need a lot of our team, our IRDIs, our nurses, our compounders, and we have to make them good opportunity for their career growth, for their income, for their satisfaction and all the training so that they have a very, very satisfied professional life. So this is a big challenge, like creating human resource and the making rural living very safe and comfortable. So these are the challenges that we human resources, doctor, nurses, everyone is inadequate. We have the gap between knowledge and skill, inadequate training method, insufficient practice of learning procedure. We have learned in the 6-month course, but we didn't give the opportunity because we were not posted at that site where these skills can be used. Lack of equipment, inability to delegate tasks, and the large variation in clinical practice, and what we say the good career opportunities. So here are the challenges which we can solve together by communicating, collaborating with all nursing council, other professional bodies. This is all our FOGSI Safe Motherhood Committee chairperson. Everybody has done a bit in their time, a lot. Dr. Datta, he is working in Kalyani, very small place. So why Mother's Day, he always spoke. Sheila Mane for all PPH workshop and PPH day. I did a lot of publication, PPH Pan India workshop, which we still today, we are continuing critical care workshop, path oxytocin inhibition. Preeti is doing a good work on the GDM for the Vistrit product and project and the networking with the other organization. So a lot of thing has been done. Still what we are doing, we are still reaching far and large societies so that we can treat the skill. Few important thing, oxytocin was never kept on the fridge, and when we needed oxytocin, it was not working. Only in 2012, we became aware of it, and I'm proud to be part of this path oxytocin initiative. Then the DPAGO 2013, that Helping Mother Survive program came, that the private sector is delivering 70% of obstetrical care, and we were the part of Pan India Helping Mother Survive program in medical college, and the creation of safe birth checklist, peer support, assessment, documentation was the Utkrasht and the Manyata what we are having today. And we are having the Center of Skill Enhancement, around 8 or 9 Center of Skill Enhancement, and we are reaching remote areas of Chhattisgarh, remote areas of Bihar, remote areas, and we are training them, and you can see this paramedical who is giving very confidently answer. So this is the thing what we can do together. We can create capacity building, confidence, and creating center of excellence. So simple thing goes a long way, simple safe birth checklist, and we have to think for the task shifting with the midwifery course. We should not be authoritative. We cannot be fearful that they will take our work or they will be doing something bad. We have to make confident them, and we have to make a respectable team member of our healthcare. So we have to break the barriers in our own mind. They always work well. Everybody say, I believe in that nurse. I believe in that nurse. If she is there, I have no worry. And that confidence we have to take. So Utkrasht and Manyata has come in a big way. We have done initially it was UP, Jharkhand, and Maharashtra. That was the initial period. Now it has spread all over the country, and we are going to get ahead. And Amrita is with us, who is also always giving training. And we actually, these are the dedication and the selfless service despite such a busy work and the responsibility. She is always there for the training, and that makes us the professional body and our associations so very strong. Obstetrical SDO ICU, Dr. Alpesh Gandhi initiated that women who become critical need critical care, and all over the country. It is now, we all are sensitized, and Dr. Sharda Jain is doing great work with a high quality academic program for the critical care in obstetrics. Our Sadhana team is doing the ICOG fellowship course as well. So that is very, very important, that the critical condition need the critical management, and our country owe to it as a healthcare provider, as a government, and as the bureaucracy. It is all my publication, and it is always so heartening to know that every teacher says that we keep in our library and our share to our postgraduates. So all works actually goes together. Our country has been great innovator. It is Nalini Mishra, point of care. Then and there you can make a bag for the PPH blood estimation. Then and there you can make the balloon tympanoid, which have the drainage channel. Dr. Alok Devdas, wonderful, the paperless partogram, and his also Devdas bag. Samartha Ram cannula, which says it never fails in atomic pph, and wherever in small cities and in all over country we say, everybody shares it that madam, it was bleeding patient was so, and the panicker cannula or the samartha cannula we did, and it was very effective. So these are very simple, and this simple cannula should be available in our healthcare system. What Dr. BP Pelly, aortic clamp for the placenta percreta and the transvaginal uterine artery clamp. So these are the great legacy our country have, and especially to young generation who always look to the developed world, and they are very costly, insurance driven, and many complexities. We must like innovate what you are having for it, and we have a great way together for our mothers. So COVID was the great challenge, and always we have challenge. COVID has passed, but we have wars, we have climate migration, and we like FOGSI professional body. I was also part of it, GCPR, that what we should do in the COVID time. So today obstetricians are also overloaded with so many act, clinical establishment, registration, medical, legal, hyperactive media, extreme aspiration of educated patient, and what we say lack of human resource. So it is time to work together. We have to cross barrier. We have to like embrace openly all the association and all the leaders, and we have to develop the leadership from every city. So we have the technology. We know what does it work. We have today political will, a strong political will, but missing element is the health sector readiness. We have to change our mindset. We draw the young people to the obstetrical care because it is rewarding financially, name, fame, everything, and combination of financial, human, and organizational resource. So from MDG to SDG, we have to cross the equity. 3.1, it is all about reduction of maternal death, institutional delivery, infant mortality, which is part and parcel of the women reproduction, and the contraceptive method. So SDG is the way ahead. So let us appreciate what we have done. The dreams of yesterday are the like a action of that, like a priceless for the today and the dream of the tomorrow. So way forward is it is the last slide that further progress in improving maternal health will require outspoken and determined leaders from the medical community, particularly the OB-GYN. India can progress towards SDG with the strong advocacy, with the political and professional commitment, robust health system which reach the rural and difficult geographical terrain. We need to develop a good, strong system and the confident system that it is not blaming and shaming for monitoring, evaluation, and accountability, and the good funding as well, and joining and respectful relationship between public and private and other organizations. So they are all join the movement of saving mothers, devote your talent, treasure, and time for saving mother and the health of generation next, because every science should reveal soul out of heart. So Safe Motherhood initiative is an issue of social justice. We have to work on many arms. Thank you for this opportunity, for the active listening, and wishing everyone a safe motherhood. Very thoughtful Safe Motherhood Day. Thank you very much.
Amazing, ma'am. Amazing. It was wonderful. बहुत ही अच्छा था. Now over to chairpersons for their comments. Let's start with Usha Sharma, ma'am.
Oh, thank you so much, Amrita. I'm very sorry, Sadhana. Part of your talk I could not listen. There was some problem. I even rang Amrita that what to do, but fortunately then I could get it in the laptop. I will really like to congratulate for a very, I must say, informative, as well as you have explained everything so nicely. Because these days it's very easy to say safe motherhood, surakshit matratva. But actually we should understand actually what it is. And these days we have understood that by introducing the Safe Motherhood initiative as well as the maternal safety bundles, by having a standard methods to deal with with the obstetric emergencies, we have seen that we have certainly reduced the maternal mortality in northern India region like Delhi, Uttar Pradesh, Haryana, and Punjab. We all know that there are four main causes of maternal death, like maternal sepsis, obstetric hemorrhage, and thromboembolism, as well as the severe hypertension during pregnancy. The only thing which we should always appreciate and know that fortunately these conditions are preventable and even modifiable if treated on time. And we should be very, very careful in diagnosing these things. And nowadays, as she also explained everything, that we have to bring badlav. We have to have a revolutionary change so that, and that our Rishikesh is also always talking about, that this badlav we can bring by Samanta, Ekikaran, and Takniki, and then we will be able to certainly reduce the maternal mortality. But for all these things, we should be very, very careful, and as far as possible, we should create awareness in the public. Sadhana has told everything what government has done and what policies we have made. But the problem is that these policies are not being told to the public. They are actually not able to avail these things, whatever facilities are being given. And our aim should be to achieve SDG, as she said. And we, as I told in the beginning, that actually our target is to bring maternal mortality to 70, which was in 2020 as 97. And if all the things which this Sadhana has told us today, Sadhana, I really appreciate the way you have explained each and everything. It was exhaustive, but it was very well, it was really so easy to understand, and we should just promote these things in our day-to-day practice, because our aim is no maternal death of a pregnant mother. If we just have this objective, then only we will be able to do something. And I really congratulate you, Sadhana, once again. And I'm sure that whatever objective you will have in your life, you will certainly fulfill. And I really wish you all the best at every step of your life. Thank you very much. And everybody who has been attending this talk, they must have been greatly benefited, and we can certainly just do these things in our day-to-day practice so that we make it practical and we just ensure that our pregnant mothers do not die. Thank you very much.
Thank you, ma'am.
Sadhana ji, thank you. And as usual, very informative, very knowledgeable things. And definitely the two things are, which is very important. One thing is awareness among us also. And one thing is, ma'am, quality care. And that is to be included in the MBBS curriculum.
Yes.
Ma'am, just with Manyata and all, we are creating this thing. And that is the one of the important part for the safe motherhood. And the mothers can be safe. They can be safe. Maternal morbidity, mortality, how we can reduce. This is only the way forward. And we all know that you are working hard on this path. And really, all the best for your future endeavors. And definitely for the safe motherhood, you have worked hard. And under your guidance, we are ready to work again. Thank you. Thank you.
Thank you, Leela ma'am. We would like to hear from Dr. Kamal Bakshi ma'am, Dr. Madhu ma'am, and Dr. Saroj ma'am also. Dr. Kamal Bakshi ma'am.
Unmute kariye, madam.
Shada ma'am, namaskar.
Hello,
Dr.
can you
Bakshi,
hear?
unmute kariye, please.
हाँ, मैंने unmute कर दिया. Can you hear
Yes,
me?
ma'am. Yes, ma'am.
Yes,
We can hear you. Yes. Yes.
My heartiest congratulations to Dr. Sadhana. And I would say it is not only a simple diamond, it's a blue diamond oration, the rare one. And second, a standing oration. Now, the message that she has said, and I would say that it is the teamwork, number one. Second, trust that we have to take. And to third, it is the rural we have to think, you know. I remember when I went to Bhutan, there the people, they recruited, they would take the bike and go to the mountains to conduct delivery, you know, and they brought down as far as their mortality was concerned. Now, as far as the FOGSI, when 96 became, I said in my talk, and I felt we have to adopt a rural, and because ICMR had made many postpartum. So think rural. And second, trust the ASHA workers. They are doing a great job, but these ASHA workers should be young. Third is the quality. When we went through the ICMR, we saw primary, secondary centers were not functional, but they can become functional. We have become a long way. We are joining hands. I would say all the association, NARTI, FOGSI, everybody is doing a bit. And I think I am so happy today to see that our mothers will be safe. One point is, when we want to drive a car, we see, is there a petrol hai ke nahi? Isme pani hai ke nahi? Now the mother starts a journey and she's not prepared, you know. Nobody takes care. When she delivers, the girl is not taken care of. And I will say our great leaders, as far as Dr. Iron infusion was started, then Dr. Bhaskar Rao, Dr. Rohit Bhatt, and our modern Dr. Sharda Jain, look at the anemia mukt. All this and each and every one who's here will be able to bring down. Thank you for giving me the time. I'm really excited for this great moment. Namaskar to everybody.
Thank you, ma'am, for the wonderful words.
Thank you.
Thank you, ma'am. Dr. Madhu, ma'am. She was here.
Yes, Saroj, Dr. Saroj Mudgil has
Yes, ma'am. Saroj, ma'am, please.
Good evening, everyone. All of us have listened to Dr. Sadhana Gupta. She has given a very nice, exhaustive, educative, and she has not left even a single aspect of the Safe Motherhood initiative. So I would not like to repeat anything. I must congratulate her for such a very nice presentation, and she deserves, and I never knew you are so much qualified, and you are so much intelligent, and you are so much caring, and you are so much involved in FOGSI and everything. And you are a very good presentation. I must congratulate you. And I can not anything, I can never ask you to ask ourselves to repeat anything out of it, because you have covered each and every aspect of the topic, starting from the Safe Motherhood initiative and what can we do it, and how can we prevent it, and how we can reduce the maternal mortality to negligible as compared to USA. So in our Haryana, I can just tell you what are the strategies which are followed to reduce the maternal mortality. So in this, we improve the status of the women through the education, health career opportunities, vocational training, which enables to achieve the economic independence, and they become the equal partner in the nation building. And number two is the reduce the high fertility through the family planning. So we advise accordingly as what should be the age of the marriage and what is the parity and what should we advise to reduce the population also, because in India we are now trying to become number one on the this population control. So, and we have to upgrade our tertiary care hospitals and district hospital to contrary acceptable level to the health care. And we, because it has making the transfusion, blood transfusion services also available, and network is very much good in Haryana. So we are able to reduce the maternal mortality and morbidity. And we have improved our obstetrical services by making the antenatal care more accessible to the patients, and it encourages the supervised institutional deliveries or the home deliveries, which are done in the villages. We are getting the deliveries done in the obstetrical huts which are made, and the deliveries which are easily occurring, which are already screened, they are done by the staff nurses which are trained for this delivery, and otherwise they will refer the patient to the referral center, and for this the facility is available 24 hours for carrying the patient from one center to the higher center or the tertiary care center for the help. And that is how we are able to reduce our mortality. And we have improved the standard of the care of the women in labor, and accessibility of the medical termination of pregnancy. The law has become very strict in Haryana because they don't give the medicine given by the chemists, because here the practice of the medicine given by the chemist was more, and that is why the morbidity, maternal morbidity and mortality was also more. They never knew to whom this tablet has to be given or not to be given, and they used to come to us with the complications. And now they have made a strict rules that this has to be given by the licensed or the trained obstetrician, and the stock register has to be maintained, and proper consent register has to be maintained also in these cases. And they maintain the proper training of the health personnel to deal with the obstetrical emergencies. And we are training our MBBS students also for the anesthetic skills, so that they can also manage at times in the periphery with the problem if they arise. And we also utilize the services of the media like television, radio, news, etc. to promote the women's health and awareness amongst the public. From time to time, the government of Haryana has started many health programs to improve the maternal. So the time is very less, and that's why I will skip over, because she has given each and every angle. Dr. Sadhana has covered each and every angle of the topic, so there is no use repeating it. Death from the ectopic and ectopic abortions and ectopic is also included in this, and these deaths can be due to the direct, indirect, or the incidental causes. Medical mortality rate is about 120 in India as compared to 0.5 in USA. The new initiatives which has been taken is that we train the MBBS doctors for the life-saving anesthetic skills. We'll set up the blood storage centers. Then there is a Janani Suraksha Yojana, which is initiative care for the increased initiative is taken for the below to poverty range ladies. Then there is a Vande Mataram scheme, which is the private doctors can also voluntarily provide their the services to the Safe Motherhood. And then there is a National Rural Health Mission, which was started in 2005. This is health for all. Then very important is the training of the ASHA workers, which is very important. They are very good activities in this between the community and the public health. And the ASHA worker, the worker ANMs, and under the leadership of the Panchayat Health Raj, they are doing very well here in the Haryana. So I think with all these facilities which our government is giving, and our doctors are following, and our ASHA workers, our ANM, their staff, and other paramedical staff is helping, and the policies of the government are like this, so that we are able to reduce our maternal mortality in Haryana. It is not now a remote place. So in the end, I will not talk anything else because everything has been covered. So it will be useless to talk at this in front of Dr. Sadhana, because everything has been covered. And
she has done very well,
Dr. Sadhana for a very good, very excellent, exhaustive presentation, and I must congratulate you. Thank you.
Thank you, ma'am. Thank you for the encouraging words. And Madhu, ma'am, is she there?
Madam is there, but I think she's not able to.
I mean, unmute herself or something like that.
Madhu, ma'am, are you able to hear us? I think she's not there, ma'am.
Well, I think
So we'll conclude this session, but a final word from Sharda Jain ma'am once again.
Yes, of a patron,
Yes, ma'am.
I
the
think
most enthusiastic worker, I must say.
it was
Madam, unmute.
Unmute करिए शारदा. शारदा unmute करो. हाँ
can you
हाँ
hear? Yes.
हाँ अब ठीक है.
Yes. I think it was an awesome deliberation by Dr. Sadhana. Congratulate her again for summarizing in a very short time, in a very emphatic way, what she
Yes.
felt about things had been there. Here, I just wish to just tell you that we have been going very slowly, and Madam very rightly has worded it. It's a silent revolution. But the things which had been played, which did a wonderful job, she cited this particular two things. One is Asha, and another is Janani Suraksha Yojana. Many of you probably will not know, Dr. Sangeeta is here because we believe in working very silently. Asha is the brainchild of we people. We sold it to the Secretary Health during that time because we trained 100 people and we called Health Secretary to give the certificates. And he said, Madam ne aapko kya sikhaya? तो उन्होंने कहा उन्होंने हमें आधा डॉक्टर बना दिया. And he picked up this particular scheme. Then we pleaded him and the Ambumani Ramdas that, he should stop training guys and he should allow delivery in primary health center, because if the delivery is conducted by nurse, she will save the life of a woman. And I think, we started from 20% delivery at that particular time in institutional areas, and now it is plus 90%. And what is now remaining is emergency services. I think everything has been covered very well. We are working very hard on it. But I say still when we are losing it, it is the critical care which every obstetrician who is conducting in 5 deliveries a year should be trained in critical care. And I think, that is going to be the final game changer. If you want to 70, we'll come down by 2030. There's no problems in that. But what I feel is we have to go beyond that particular thing. Now, lastly, I just wish to tell you, I've been called many times to save the mothers for what? अगर हिंदुस्तान जगत गुरु बनना चाहता है, थर्ड इकोनॉमिक पावर तो बन जाएगा, मोदी साहब कर देंगे. पर अगर जगत गुरु बनना चाहता है, it is the woman power, it is the woman of the house, it is lady of the house which has to give the character. जगत गुरु बनाना है, she is going to make the character of a woman. वो हमारे गर्भ संस्कार से आएगा, हमारी वैल्यू से आएगा, वो उसको कैरेक्टर बनाएगी, उसको कंसिस्टेंसी सिखाएगी कैसे काम में होता है. You can see Sadhana for the last 22 decades she's been working on it, and this shows a consistency. Then that comes credibility will automatically come. So you have to save this woman of this country if you want this particular country to be seen as Jagat Guru. So I think with that kind of regards, people like me do not tell about, what are the two schemes, but I think another thing which I always say, that don't aim 11 gram %, aim 12 gram %. Then she will be able to stand the process of delivery. I lost my mother during the childbirth. And my father told me one thing, that kuch logon ka bhala kar dogi to acha hoga. Let's do it collectively. It is possible. And I think, we should start seeing much ahead. And I again agree. We डॉक्टर्स को घबराहट होती है कि नर्सेस कर लेंगे तो फिर हमारी क्या जरूरत होगी. नहीं, बहुत हैंड्स की जरूरत है इस कंट्री में लेने की. हमको सबको साथ लेकर चलना है. That's what I wish to tell you. And I think it has been absolutely great day. And the International Mother's Day will be, the oration will become from Dr. Manjupuri. That will be on the next month. It will be there. So again, Dr. Sadhana, kudos to you. And I'm sure on this occasion, I will definitely say that we are working very hard to support you, and you have to take this leadership with you. I wish you again very good wishes from the behalf of everybody who's the ambassador of North India Gynecologist Forum, that you become a winner as per the FOGSI elections are concerned. Thank you very much.
Thank you, ma'am.
Thank you. Thank you very much for
Thank you,
all
ma'am.
the words of wisdom and your precious blessing. Thank you very much.
Thank you, ma'am. With all the congratulations and best wishes. Yes, ma'am, your lecture was awesome. And I found you emotional also. You were a bit emotional when you were reading that she's not statistics, she's a person, she's a face. Okay, so now we conclude this wonderful session. And now I hand over the platform to Dr. Anita Rajoria, who will carry the poems and poetry competition forwards. Over to Anita, ma'am.
Sharda, can you excuse me? Anita, somebody has come. Sharda, can you excuse me now?
Please, ma'am.
Thanks for joining.
Thank you so much. And I really admire your leadership, Sharda. You have started such a group which will go a long way, I can say, in helping the persons from North Zone to do something, to recognize them, and we can make our existence valid. And thank you very much
Dr.
for
Usha
your
जी, एक बात
efforts
बिल्कुल
to
क्लियर है,
have
मैं
this.
और डॉक्टर बख्शी यहाँ पर हैं, मेरी से सपोर्ट है। आप जब सब लोगों का हाथ नहीं मिलेगा, ब्लेसिंग्स नहीं मिलेगी नॉर्थ इंडिया गायनेकोलॉजिस्ट फोरम को, यूनिटी नहीं आएगी।
Sharda, because what I feel, whatever you are doing, it is not for your selfish motive. It is for the interest of doctors of North Zone. And we should understand that we are actually in the beginning. I also had some confusion because we are not doing anything against FOGSI. We are part of FOGSI and we will always remain the part of FOGSI. But we are North Zone persons. So really, I appreciate whatever you have done as patron. You have really fulfilled your job very well. And certainly, I will like to congratulate Kamal Bakshi ji, who has always been so supportive and who has always helped us to take this forum ahead and ahead. And thank you very much. With these, I will just ask excuse because there is someone come. Otherwise, I would have sitting and Sarveshwari. ये सब लोग बैठे हुए हैं अभी जो बढ़िया बढ़िया पोइट्री होंगी ये मेरे ख्याल में ये बाद में रिकॉर्डिंग तो हो रही होगी ना साथ में
जी हाँ मैडम वो सब गूगल ड्राइव पे रहेगा।
Thank you very much for giving me this opportunity.
मैम एक बात धन्यवाद, एक बात सुन के जाइए। मेरी माता और आपका आशीर्वाद, ये दो आशीर्वाद मेरे जीवन में हमेशा मेरे मार्गदर्शक रहेंगे। और अब मुझे मार्गदर्शन मिला शारदा जैन मैम से, साधना गुप्ता मैम का आशीर्वाद मिला, सब साथियों का हमारे पास आशीर्वाद है, तो हम इस जरूर आगे लेके जाएंगे सेफ मदरहुड कैंपेन।
Anita, I am really blessed to have students like you. सच कह रही हूँ, मैं अपना टीचर होने में मैं सोचती हूँ कि मेरी सबसे बड़ी अमानत या मेरा सबसे बड़ी जायदाद मेरे स्टूडेंट्स हैं। And you are one of those who have really proved. सर्वेश्वरी मेरे सामने दिख गई फौरन। So सर्वेश्वरी तेरा नेटवर्क चल रहा है?
I beg your pardon, ma'am. Just stay for a while, ma'am. Just stay for a while.
अच्छा, okay.
Like I would request all the
मैम आपकी बात सब सुन रही हूँ।
I'll request all the chairpersons and Sharda Jain ma'am, please join to present the plaque to Dr. Sadhana Gupta ma'am.
Okay.
I'm so sorry I missed that.
No. ये तो बहुत जरूरी है. Very good. Very good.
Very good.
I'm humbled and honored. Yeah. Thank you.
Very good.
Thank you. Thank you, ma'am. Now, Anita, Dr. Anita, you can continue.
Yeah, thank you everyone. इतनी अच्छी बातें सबने करी हैं। ये सेफ मदरहुड का ओरेशन हमने अभी सुना। हम लोग कर्तव्य हमारा इनके प्रति रहेगा, जो भी योजनाएं हैं सरकार ने दी हैं, पर हमारा अपना जो पर्सनल एक कमिटमेंट है उसके विषय में हम क्या सोचते हैं, इस बात को ध्यान में रखते हुए साधना मैडम और मैंने ये टॉपिक सोचा था, NIGF की तरफ से हमने ये कंपटीशन कन्वीन कराया जिसका की टॉपिक था सुरक्षित मातृत्व, हमारी प्रतिबद्धता, मीन्स हाउ आर वी कमिटेड फॉर दैट। तो ये टॉपिक इंग्लिश में या हिंदी में दोनों में हमने दिया था, सेफ मदरहुड, आवर कमिटमेंट एंड रेजोल्यूशंस, व्हाट वी कैन डू टू डिक्रीज द मैटरनल मोर्टालिटी इन इंडिया, इन आवर नेशन। तो बहुत सारी पोइम्स हमारे पास आई, बहुत सुंदर सुंदर कविताएं लोगों ने भेजी, कुछ इंग्लिश में थी, कुछ अपनी मातृभाषा में थी। और हमारे आदरणीय जज रहे डॉक्टर अमिता त्रिपाठी मैडम, कृपया इनकी CV दिखा देंगे गिरीश जी। डॉक्टर सर्वेश्वरी, डॉक्टर ज्योति हक जो है प्रोफेसर HOD थी, डॉक्टर ज्योति हक हैं गवर्नमेंट मेडिकल कॉलेज जम्मू से, सर्वेश्वरी मैडम हमारी देहरादून से हमें ज्वाइन करी हुई है, बीच बीच में उन्होंने हमारे को दर्शन दिए इस वेबिनार के दौरान। अमिता त्रिपाठी जी ने हमें प्रयागराज से ज्वाइन किया है। मैडम भारती, शाजिया मोनिस जी ये थी मुरादाबाद ऑक्स गायनी सोसाइटी की एक्स प्रेसिडेंट रह चुकी हैं और बहुत एक्टिवली इन्वॉल्व है और खुद भी कविताएं भेजती रही हैं, मैंने पिछली बार कंपटीशन में देखा था। तो ये हमारे आदरणीय जज थे, इनको मेरे को लगा काफी मुश्किल समय इनका रहा होगा क्योंकि इतनी सारी पोइम सुंदर सुंदर इन्होंने जज करी और जजमेंट जो थी बहुत सारी चीजों को देख के किया गया था कि कंटेंट कैसा है, 8 लाइनों का वाक्य लिखना था, 8 वाक्यों से उसको अपनी सारे विचारों को 8 लाइनों में समावेश करना था, वो कैसे उसको प्रेजेंट किया गया, कैसे उसको दिखाया गया, इन सब चीजों को देखते हुए इन्होंने आंकलन किया है और जो रिजल्ट है वो अभी आपको गिरीश जी दिखाएंगे PPT में। बहुत सारी पोइम्स आई, 22 से ज्यादा पोइम्स थी, पर हम टॉप 5 जो है मैं पढ़ के सुनाना चाहूंगी क्योंकि इन लोगों ने बहुत मेहनत करी है। तो कृपया पहले प्रोजेक्ट करेंगे, ये रिजल्ट रहा। तो सभी वैसे बहुत सुंदर थे। फर्स्ट विनर अगला दिखाइए, अनीता गौतम जी हैं, द्वितीय पोजीशन है युक्ति की। फर्स्ट विनर अनीता गौतम जी ने लिखा चेतना बंसल, अनु अरोड़ा, प्रतिभा अग्रवाल, अर्चना वर्मा जी, मोनिका गुप्ता, पूजा ददवाल, उपमा यादव, अनुजा गोयल। इसमें से कई हमारे सदस्य ऐसे हैं NIGF के जो परसिस्टेंटली अपनी एंट्रीज भेजते हैं। जब भी हम स्लोगन भी करते हैं, हमने छोटा काव्य रचना पे भी करी, तब भी इन लोगों ने कहा। तो मेरी बहुत बहुत इन सबको शुभकामनाएं और बहुत बहुत धन्यवाद। फर्स्ट विनर का जो पोएम था उन्होंने लिखा सुरक्षित मातृत्व पे, स्त्री रचती ब्रह्मांड सारा, उसकी सुरक्षा उद्देश्य हमारा, प्रसव न बने मृत्यु का कारण, उचित देखभाल से होगा निवारण, जच्चा बच्चा पर आए ना आज, गर्भावस्था में कराएं सारी जांच, सुरक्षित रहेगी जच्चा हर हाल में, यदि प्रसव कराएंगे अस्पताल में। बहुत बढ़िया लिखा है, सारे मैसेजेस बिल्कुल क्लियर लिखे हैं और उन्होंने गागर में सागर भर दिया है। अगला स्थान ग्रहण किया है डॉक्टर युक्ति भारद्वाज ने, ये गंगाराम अस्पताल की FNB की में वो हैं। इन्होंने लिखा आई प्लेज टू सेव एवरी मदर एज एवरी मदर काउंट्स, विद सेफ मदरहुड प्रोग्राम्स द हेल्थ ऑफ नेशन माउंट्स, providing good preconception care, optimizing every disease that haunts, good antenatal, intranatal, post and perinatal care, improves maternal mortality rate by leaps and bounds. बहुत सही कहा है, यह हमारी यंग जनरेशन है, हमारे सारे जितनी भी हमारी ये आशाएं हैं इनको आगे लेकर जाएंगी। अगला दिखाइए गिरीश जी। थर्ड रही डॉक्टर चेतना बंसल, माँ बनने का एहसास। इन्होंने लिखा है मांगने पर पूरी वहां हर मन्नत होती है, अस्पताल ही है जहां वहां जन्नत नसीब होती है, माँ बनने का एहसास जब दिल को गुदगुदाने लगा, कठिन समय का भय दिल की धड़कन बढ़ाने लगा, तिमाही परीक्षण करने में डॉक्टर दीदी के पास जाने लगी, जटिलताओं से उबरने की खातिर नसीहतें में पाने लगी, रफ्ता रफ्ता दिन बीते, प्रसूति अस्पताल में करवाई, सुरक्षित मातृत्व की ओर कदम बढ़ाकर बेटी को मैं घर ले आई। वाह, बहुत सुंदर, बहुत सुंदर। एक माँ का क्या एक्सपीरियंस रहता है ड्यूरिंग प्रेगनेंसी और गर्भावस्था में, और उसके बाद जब वो बालक को घर खुशी खुशी लेके जाती है। बहुत सुंदर एहसास इन्होंने ये लिखा है। 4th विनर रहे डॉक्टर अनु अरोड़ा जी जलंधर से। उन्होंने लिखा, मदर इज अ गार्जियन एंजल फॉर ऑल, yet her journey to motherhood is fraught with hills and falls. With menarche, anemia glares in her stride. Pregnancy, lactation, and abortion take her on a roller coaster ride. 2 lives, 1 body. She deserves a smooth drive. To make her journey safe, let us all strive. Awareness, education, and nutritious food will build a foundation for safe motherhood. True to every word, Dr. Anu Arora. Congratulations for that. The 5th winner is Dr. Pratibha Agarwal. I think she has been a consistent winner. She has been, contributing to each and every competition. माँ बनना ही नहीं है काफी, सुरक्षित मातृत्व है संकल्प हमारा। परिवार नियोजन सभी अपनाए, गर्भपात की नौबत ना आए। गर्भपात भी बने सुरक्षित, खून की कमी न होने पाए। गर्भवती महिलाओं को दें पौष्टिक आहार, आयरन कैल्शियम हो गर्भावस्था का आधार। नियमित प्रसव पूर्ण जांच कराएं, उक्त रक्तचाप मधुमेह संक्रमण का पता लगाएं। जटिलताओं का होगा समय पर उपचार, तभी बनेगा प्रसव सुखद एहसास। प्रसव में स्वच्छता का रखें ध्यान, अधिक रक्तस्राव से करें बचाव। निकटवर्ती अस्पताल में हो प्रसव व देखभाल, तो होगा सुरक्षित मातृत्व का अपना सपना साकार। बहुत सुंदर। और बाकी भी जो है, मेरे को लग रहा था कि जजेस को कितना मुश्किल रहा होगा जजमेंट करने में कि कौन सी। बहुत ही मैंने सारी कविताएं पढ़ी है शारदा मैम, एक से एक बढ़कर है। और किसी का मतलब आंकलन करना, उनकी कैसी भावनाओं से उन्होंने लिखा, बिल्कुल बहुत ही सुंदर कविताएं आई हैं। और हम जरूर शेयर करेंगे इसको अपने वेबसाइट पे। तो मैं चाहूंगी कि जो हमारे जजेस हैं वो अपना एक्सपीरियंस शेयर करें, उनको कैसा लगा और वो क्या मैसेज देना चाहते हैं आज के दिन। सर्वेश्वरी मैडम, पहले आप अनम्यूट कर लीजिए।
मेरी आवाज आ रही है?
हाँ जी।
अच्छा, ओके। मैंने सारी कविताएं पढ़ी और बहुत सुंदर लिखी हुई थी। इंग्लिश में युक्ति ने लिखी थी, बहुत ही टचिंग थी। और मुझे उन कविताओं में सब में एक ही चीज नजर आ रही थी, माँ। माँ से बड़ा कोई दूसरा शब्द नहीं होता है। तो माँ वाली फीलिंग, इट वाज टचिंग द हार्ट। मेरे को लग रहा था कि हर लड़की ये चाहती है कि माँ को कैसे सुरक्षित रखा जाए। और मैम शारदा जैन को मैं पहली बार देख रही हूँ। मैम आपको नमस्कार। और आपने जो कदम बढ़ाए हैं आगे, उसको पीछे पीछे हम फॉलो करेंगे, ये मेरा प्रॉमिस है। और साधना के लिए लोगों ने बहुत कुछ बोला, लेकिन मुझसे पूछो कि जिस दिन मैंने पहले दिन इसको देखा और मुझे सामने दिखी 10 गोल्ड मेडल लिए हुए लड़की, मैं तो बेहोश होते होते बची। मैं इतनी और माला बहुत अच्छी तरह से, ज्योति जी को मैं पहली बार देख रही हूँ। बाकी अमिता तो मैं साथ ही में रही हूँ, और अनीता तो वो है। मुझे पता है कि तुम लोगों के अंदर जो गुण है, वो गुण, उन गुणों को एक्सप्लेन करना बहुत मुश्किल है। एक बार मैंने शारदा जी का गाना सुना था, उससे मुझे लगा था कि कितना एक लेडी डॉक्टर कितना अच्छे से उसकी मदद कर सकती है जो जरूरतमंद है। तो मैम आपकी तो मैं फैन होगी। और इन कविताओं में अगर मुझसे पूछो तो मुझे ये कविताएं बिल्कुल अच्छे से मैं कह सकती हूँ मुझे याद है, क्योंकि मेरा चॉइस का सब्जेक्ट है और मैंने इसको सुनाया भी है। मैं आज बाहर थी, कविता मुझे पहले मिल गई थी, मैं जहाँ गई थी वहां भी मैंने इसको, इन कविताओं को सुनाया है। आई विश मैं मैडम की तरह गा सकती तो मैं गा के सुनाती, बट लड़कियों ने इतना सुंदर लगा, मुझे तो लग रहा था सारी विनर है। मैं किसको कम मार्क्स दूंगी, किसको ज्यादा दूंगी, ये बहुत मुश्किल था, क्योंकि जो भाव थे वो भाव बहुत अच्छे थे। तो मैम शारदा जैन, इन भावों को उत्पन्न करने के लिए दिल से, तहे दिल से आपका धन्यवाद। और साधना मुझे जोड़ने के लिए, और अनीता मेरी कॉलेज की है, मेरी जूनियर है। माला को मैं बहुत अच्छे से जानती हूँ इलाहाबाद से, और अमिता के साथ तो मैं रही हूँ इलाहाबाद में। तो मैं मतलब हर एक को बहुत ही दिल से ये चाहती हूँ कि जिस तरह से आप लोग माँ के लिए काम कर रहे हैं, वो काम बहुत ही ऊंचा है, उत्कर्ष है, और उस काम के जरिए हम ऊंचाइयों को छुएंगे, ये मुझे पूरी उम्मीद है। इन लड़कियों की भावनाओं को मैं सादर प्रणाम करती हूँ, और जो विनर है उनको कंग्रेचुलेट करती हूँ। अमिता, आप कुछ?
धन्यवाद सर्वेश्वरी दी। डॉक्टर अमिता त्रिपाठी, आप प्रकाश डालिए, आपका कैसा रहा एक्सपीरियंस?
गुड इवनिंग एवरीवन। प्रणाम सभी अग्रजन और गुरुओं को। आज की कविता जब अनीता जी का मेरे पास फोन आया तो मैं ट्रैक पे थी और अब 12,000 ऊंचाई पे थी और वहां फोन लग गया। मैंने कहा कि शायद जब उन्होंने कहा कि कविता जज करनी है तो मैंने कहा कि नहीं, ये तो मुझे करना ही करना है। तो जब एक एक कविताओं पे मैं गई तो ऐसा जैसे कहते थे ना, गागर में सागर भर दिया था। डॉक्टर साधना गुप्ता ने जो अपने लेक्चर में बताया, मुझे लगता है इन कविताओं में, सब कविताओं में ले ले तो लड़की सबने एक एक पॉइंट्स उसमें इंक्लूड किए थे। आप प्रेग्नेंट होने से प्री कंसेप्शनल केयर, एंटीनेटल केयर, आयरन एंड कैल्शियम, क्या कहते हैं, कॉम्प्लिकेटिव डिलीवरी के बाद परिवार नियोजन, आशा बहुओं के बारे में, और इवन 108 वाली एम्बुलेंस के बारे में भी कविता में उन्होंने इंक्लूड किया था। मतलब किस तरह से इतनी सारी जो पूरी जो हम कहते हैं ना कि जो आज हम बात कर रहे हैं सेफ मदरहुड की, वो इन कविताओं में पूरी भर गई थी। तो मैं बहुत समय नहीं लूंगी। थैंक यू शारदा मैम, थैंक यू साधना मैम, थैंक यू NIGF फॉर दिस इनिशिएटिव, सबको साथ लाने के लिए और एक सूत्र में जोड़ने के लिए। हम ये एक संकल्प लेते हैं कि हम सब आगे बढ़कर एक दूसरे से हाथ में हाथ मिला करके इसमें आगे बढ़ेंगे। एंड कॉन्ग्रेचुलेशन टू द विनर्स, और सबको मेरी तरफ से सबको बधाइयाँ जितने लोगों ने भी पार्टिसिपेट किया है। थैंक यू सो मच।
धन्यवाद अमिता मैम। आदरणीय ज्योति मैम, आपसे अनुरोध है, कृपया कुछ बोलें।
नमस्कार एंड थैंक यू। गुड इवनिंग एंड ग्रीटिंग्स फ्रॉम जम्मू। Let Mata Vishnu Devi bless us all of us, all of us doctors, particularly who are taking care of mothers in the antenatal period, postnatal period, and giving a good intranatal care, postnatal care, and everything. I must thank Dr. Sadhana and Dr. Anita for inviting me to this poem competition. I am really blessed to be in this as a participant. I want, before thereby more contestants, some lines were written by Dr. Monica. That was very good also. It really touched my heart. Dr. Monica, who is not in the selection list, that really touched my heart. I want to put some few lines, like I want to say, a mother's love, pure and true, nurturing life all the way through. Let us honor and cherish it every day and save motherhood in every way. Because in J&K, maybe we cannot reach the remote areas, particularly hilly areas, and we are getting patients who are not able to get the services, health services, and we are getting patients in a very bad condition from the periphery to the hospitals. Let us all make this health system a robust health system, and there should be some airlifting system for picking up those patients from the hilly areas to the peripheral centers, because they cannot be reached, and it takes 2 to 3 days to get a patient from the peripheral health system, periphery to the tertiary care center. And I really get annoyed to see them. They are with the 2-gram hemoglobin, they are with hypertension, they are with, and I really appreciate the efforts put by Dr. Sharda Jain and others in making this North Zone a system, North Zone members, so that we can participate in hilly areas, and there should be a system for referring the patients from the periphery to the this I can say to the tertiary centers, because we are getting patients still in a bad condition and we cannot save them at times. Thank you. With these words, I conclude. So the health system should be a robust health system.
Yes.
For
धन्यवाद ज्योति मैम, आपकी बात से मुझे एक वाकया याद आ गया है। ऑल्दो हमारी माननीय शारदा जैन मैम कहती हैं कि नेगेटिविटीज को हाईलाइट नहीं करना चाहिए, बिल्कुल आपने सही बताया। क्योंकि मैडम मैं आप बताना चाहूंगी कि मेरी एक अपनी गायनेकोलॉजिस्ट अनुज, फॉर वांट ऑफ ब्लड she lost her life. She was a gynecologist herself. So it is really sad, but अभी सूरज दिख रहा है, हम देख रहे हैं प्रकाश आ रहा है, तो हम आगे की तरफ बढ़ रहे हैं।
Take a pledge.
Yes,
for providing services to the people in the rural areas.
Yes,
that is what I hope.
Thank you for highlighting
Thank
that.
you.
There should be a robust reference system also.
Yes.
डॉक्टर मधु नागपाल आ गई हैं। डॉक्टर मधु, आपका कमेंट हम लोग मिस कर रहे थे। डॉक्टर मधु।
डॉक्टर साधना,
यस,
जितने साल आपने काम करा, ये सब आपके काम का नतीजा है कि यू नो द टोटल जर्नी ऑफ द थिंग्स एंड हाउ दे हैव इवॉल्व्ड ओवर टाइम. So maybe it's just, one has to recognize how you have piled up the things and given the data and everything so chronologically how it has happened in our lifetimes. All the things which have come from time to time have been narrated, and it was a wonderful oration. Really told us the past and the future. So nice of you. Very nice.
धन्यवाद मधु मैम।
थैंक यू।
हमारी एक और जज साहिबा थी, डॉक्टर शाजिया मोनिस, वो आज रमादान की वजह से हमारे साथ नहीं जुड़ पाई हैं। हम सब की तरफ से उनको रमादान की शुभकामनाएं। मैडम ने अपनी ग्रीटिंग्स भेजी हैं, वो ज्वाइन नहीं कर पाई। तो बहुत बहुत धन्यवाद सभी जजेस को। और जैसे कि सर्वेश्वरी दीदी ने बोला, सभी अपने में जो है एक प्राइज विनर हैं। ये जो कला है, ये जो आपकी भावनाएं हैं, वो अपने आप में बिल्कुल आप उसको कंपेयर नहीं कर सकते किसी से, और सबकी भावनाओं का हम आदर करते हैं। सबको बहुत बहुत शुभकामनाएं और धन्यवाद पार्टिसिपेट करने के लिए। अंत में मैं बस इतना ही कहना चाहूंगी, मैंने भी 8 लाइनें लिखी हैं, तो अब वो भी सुन लीजिए। जन जन
धन्यवाद। जरूर जरूर। और फिर लास्ट में 1 मिनट मुझे भी दीजिएगा।
जी मैम। जन जन में अलख जगाना है, जन जन में अलख जगाना है, मातृ सुरक्षित बनाना है। हर जननी एवं सुता का स्वास्थ्य निश्चय कर परम अधिकार दिलाना है। हर कन्या किशोरी की रक्त अल्पता को जल्दी से दूर भगाना है। उसे स्वास्थ्य संबंधी विषमताओं की समस्त जानकारी से अवगत भी तो कराना है। महिला जब बनना चाहे माता, उसकी काया को पहले से ही निरोग बनाना है। अच्छी प्रसव पूर्ण देखभाल और सामयिक निर्विघ्न प्रयासों से प्रसव को सुलभ सहज कराना है। प्रसवोत्तर विषमताओं का तुरंत कर निदान, हर सुता को स्वार्थ आरक्षण दिलाना है। आओ संकल्प लें आज, अपने जीवन का सुरक्षित मातृत्व ही लक्ष्य बनाना है।
बिल्कुल।
तो जैसे कि शारदा जैन मैम कहती है, दोनों हाथ ऊपर करो अगर संकल्प लेना है, तो मैं चाहती हूँ हम सब ऊपर हाथ करके संकल्प लें। तो थैंक यू डियर ऑर्गेनाइजर्स, आपने मुझे मौका दिया, ये सुअवसर दिया, मैं अपने जो भावनाएं प्रस्तुत कर सकूं। आदरणीय शारदा जैन मैम, आपके शब्द।
Dr. Sharda, before you say anything, I would say one line. It's so pleasing to hear so much of Hindi. In Punjab, we have never heard this kind of Shuddh Hindi. So it was so pleasant to the ears to know this much of Hindi in it.
Even in
wonderful
JNK
doctor.
Also. Even in JNK
yeah, wonderful
also.
Doctor. Yes, wonderful Dr. Anita. It was a very spasht Hindi and Shuddh Hindi.
Very
nice.
कोई भी एरिया पीछे नहीं है। मुझे जो है हरियाणा से मैंने स्कूलिंग करी, मुझे मिला MBBS MD करने का सुअवसर उषा मैम के पास, और फिर अब हमारे को मेंटरशिप मिली शारदा जैन मैम की, साधना गुप्ता मैम की, और मेरे इतने सुंदर सुंदर प्यारे साथी माला, ये ये हमेशा हमारे को ना वो करते रहते हैं, एनकरेज करते रहते हैं। थैंक यू सो मच मधु, थैंक यू सो मच।
मेरी सभी लोगों से फिर प्रार्थना है कि अगर हमें अपना देश को जगत गुरु बनाना है तो हमने अपने बच्चों का कैरेक्टर बनाना है, ठीक है। तो उसी के ऊपर एक गरीब भारतीय बच्चा अपनी माँ से क्या चाहता है उसके ऊपर मैं गाना गाऊंगी। और यहाँ मैं बताना चाहती हूँ, मुझको कोई ट्रेनिंग नहीं मिली, ये कोविड के टाइम में मैंने गुनगुनाना शुरू किया, एंड दैट्स व्हाट इट इज। मैंने कभी किसी से कुछ सीखा नहीं है, ठीक है, इसलिए मेरा जो भी चीज है उसको माफ करिएगा। माँ सुनाओ मुझे वो कहानी जिसमें राजा न हो रानी। माँ सुनाओ मुझे वो कहानी जिसमें राजा न हो रानी। वो कहानी जो हंसना सिखा दे, पेट की भूख को जो भुला दे। वो कहानी जो हंसना सिखा दे, पेट की भूख को जो भुला दे। जिसमें सच की भरी चांदनी हो, जिसमें उम्मीद की रोशनी हो, जो हो ना कहानी पुरानी। माँ सुनाओ मुझे वो कहानी जिसमें राजा न हो रानी। माँ सुनाओ मुझे वो कहानी जिसमें राजा न हो रानी। ये गरीब बच्चों की बात है। एक चाय वाला अगर प्राइम मिनिस्टर बन जा सकता है तो उन गरीबों में ये उम्मीद किसने जगानी है? उसकी अम्मा ने ही जगानी। उसी ने उसको कैरेक्टर देना है, उसी ने उसको कंसिस्टेंसी सिखाता है। फिर ओवर अ पीरियड ऑफ टाइम वही क्रेडिबिलिटी हो जाएगी। जब ये हो जाएगा तो ये देश जरूर जगत गुरु हो जाएगा। तो मैं जो हिंदुस्तान के लिए बहुत अच्छा सोचते हैं, जो सोचते हैं कि सनातन धर्म कभी जाने वाला नहीं है, तो सनातन धर्म अगर है तो खाली औरतों ने बचा के रखा है, इस देश की औरतों ने बचा के रखा। इस बात में थोड़ा सा मनन करिएगा, जो मैंने कहा है इसमें बहुत गूढ़ चीज लिखी है। तो आपको बहुत दूर तक जाना है, बहुत दूर तक जाना है, और अच्छे भाव हमने समाज में देने हैं। इसी शब्दों के साथ कंग्रेचुलेशंस टू डॉक्टर साधना अगेन। मैं इसी स्पर में बताना चाहती हूँ कि आज वेबसाइट का फॉर्मल इनॉग्रेशन है। दो दिन के बाद आप वेबसाइट देख पाएंगे, जिसमें कि 30% जो वेबसाइट का रूप है वो आपको मिलेगा, और जो 70% है रूप है वो धीरे धीरे इवॉल्व होगा।
हम लोग इसको शो कर सकते हैं मैडम, डॉक्टर NIGF की वेबसाइट।
अच्छा, दिखा दीजिए रोशन जी।
ये मेरे यहाँ पे है, और NIGF का वेब पेज से आप हर I request everybody who is with us that you can join with the NIGF website page, that is at www.nigf.in, and you can immediately register by clicking on click to register. So it is only 1,000 rupees, like what is a registration fees for the 5 years. And we have it will be live after 48 hours. But today and the auspicious day of Safe Motherhood Day, we thought that we will launch amongst all August gathering, and we are going to have a great future together. And this is also, we seek everybody's good wishes for this NIGF, and we will be loading all the poetries, all the previous competition winners on this site, as well as the membership data will also be there. So I think we are only 10 months, but we are very systematic, methodical, and organized in our professional what is framework. And again, we request that motivate all your postgraduates, all your faculties, all your young colleagues, because we are going to have a lot of togetherness with the young academia, involvement of young people, skill enhancement, and many, many cultural events. So
डॉक्टर ये जो डायरेक्टरी है, इस डायरेक्टरी में अगर आप रोल इट करेंगे तो आपको अपना नंबर मिल जाएगा.
Yes.
किसका 1 है, किसका 5 है, किसका 11 है, सब आपको अपना नंबर मिल जाएगा. So you don't have to go anywhere from directory. You can know which is your number as far as this North India Gynecologist Forum is concerned. So thank you very much, Dr. Mala. Over to you.
My pleasure and privilege now to propose the vote of thanks after such a nice evening which has spent by listening to Dr. Sadhana Madam, as well as to listen to the motivative song from Dr. Sadhana Jain Madam. Really, this song was really very heart-touching. It's my pleasure again to propose the vote of thanks. First of all, I thank Dr. Sharda Jain Madam, who has always motivated us for all the targeted and focused academic activities. आपने सही कहा है कि माँ ही बच्चे को बनाती है, बच्चे की माँ ही पहली गुरु होती है, वही बच्चे का भविष्य संवारती है और सजाती है. I thank Dr. Sadhana Gupta Madam, our President NIGF, who is so passionate about safe motherhood, and we are lucky to hear your oration on this very important topic. And we are all definitely motivated to work at the grassroots level to save each and every mother who is there in our care. I thank our mentors, Dr. Kamal Bakshi Madam, Dr. Usha Sharma Madam, Dr. Saroj Mudgil Madam, as well as Dr. Leela Vyas Madam, who had been kind enough to chair this session in the evening. And they have nicely conducted and given their inputs during the before as well as after the oration. I thank all the judges who had given their time and their inputs while judging the so many nice poems which have been sent by the participants. I thank all the judges, Dr. Jyoti Haq, Dr. Nautiyal, Dr. Amita Tripathi, Dr. Shahja Monis, for nicely conducting this judging program as well as giving the participants their due numbers. I thank all the participants of the poem competition. As Dr. Anita rightly said, each and every participant had given their views, how they want to work for the safety of each and every mother. I congratulate all the winners for the competition, as well as I thank all the delegates who had participated in this poem competition. I thank Dr. Anita Rajoria for conducting the competition so well and conducting the second session of the evening so nicely and so flawlessly. I thank Dr. Amrita Jaipuria for conducting the scientific session so nicely, smoothly, with all the program putting into perspective very nicely. I thank all the delegates who have dropped in today evening and made this program a great success. In the end, I thank ClearNet for providing us the platform, and definitely our evening and day was met by the exceptional oration from Dr. Sadhana Gupta, and Dr. Amrita really said that Madam was not only scientific, she was also passionate and emotional about her targets of safe motherhood. Thanks everyone. Good night and goodbye.
I just want to say one thing. I will come to Delhi to meet Dr. Sharda Jain.
Yes, welcome.
You will definitely meet Dr. Sadhana is
Ma'am, your song was gift of the day. Yes. It was a gift.
Very emotional. Very emotional.
Nahin, Doctor. The awesome oration was so good that people like me definitely thought we will add थोड़ा सा इसमें सोने में सुहागा लगा.
साधना को जितना मैं जानती हूँ ना मैम, साधना को जितना मैं जानती हूँ, she is the founder of FOGSI गोरखपुर में. I was posted there. तो हम साथ में रहे. I know how she takes care of her patient. मैं तो वैसे ही फैन हूँ.
डॉक्टर साधना को जिताना है, और जिताना तो आप पहले NIGF के मेंबर बनाओ, तभी जीत पाएंगे. ठीक है, ये आपने करना है.
क्या कर रही हूँ मैम? ब्लेसिंग्स फ्रॉम देवभूमि उत्तराखंड.
बहुत
थैंक यू मैम.
And Mala, thank you. from wise up like you. A big thank. We always trouble you with. So thank you, Mala.
Thank you. Thank you.
मैडम डॉक्टर साहब ये आपकी सेक्रेटरी जनरल है, छोटी मोटी चीज थोड़ा ना है.
बिल्कुल नहीं. But secretary, a big thanks.
Thank you so much.
Thank you.
Thank you very much.
Thank you, Ankna. Now you can close the meeting. Thank you, Ankna, for all the
Thank you.
effort.
Thank
Thank
you.
you, Ankna and Anusha. So we can see, Ankna, you can close the meeting.
Thank you all for sharing your valuable insights. We are more to grateful to everyone present here. We hope we will again meet this platform again. So thank you all. Thank you for joining with us. Thank you so much.
Good.
Bye. Good night, ma'am.